The Republican bill is one of the largest transfers of wealth from working families to the richest people in our country. Robin Hood in reverse. The richest 400 families in America will get a $7 million tax break each year, to the tune of $2.8 billion break every year. It's $600 billion moving from the middle working class families to the richest families in our country. You know, it's indicative of the fact that the president really doesn't know what he's talking about when he talks about the Affordable Care Act. The goals of the Affordable Care Act were threefold: to reduce cost, to expand benefits, and to enlarge access to insurance and affordable care for all Americans. It was predicated on the idea that health care is a right for all, not just a privilege for the privileged few. And so when he talks about that, he fails to understand that not only do 20,400,000 more people have access to health care, that the rate of uninsured has been drastically reduced, practically cut in half, but apart from that, the 155 million people who have access through the workplace, probably everybody here, who have access through their workplace, have had expanded benefits. Well, it's not. He's talking about to his. No, we haven't. I know that the Republicans really don't care that much about the 20 million people who have been added to the rolls, because you can see with what they're doing to Medicaid that they want to completely undermine that. But they should care about the 155 million people who had health insurance, for whom the rate of increase in cost is drastically reduced. The investigation that we need to have. And that's what we're saying is, what is their goal? And why don't we predicate it on the facts? I speak with the speaker from time to time about how important it is to have evidence-based decision-making here. And this is so contrary. They want a fact-free area in which to make decisions. So no, do you have any suggestions? I mean, maybe there's something in there that I missed. Was it about the tanning salons, or what was that about? About putting a per capita standard on Medicaid, whether it was stopping the expansion of Medicaid. Now they're talking about even making it worse. I don't know if you've seen that this morning, worse than what's in the bill. So if you have something in particular that you think is a good idea, test me.